Hello. So let's talk about breast exam. So the breast examination is very important and required um, competence for medical students and other healthcare practitioner students. Considering how common breast diseases are, it's something that we taught at the academy we should talk about. And also continuing with our script wise approach. So remember, we've talked about wiper plus IPPA. In terms of the breast exam, something is key because it's considered an intimate exam. Uh, there is the requirement that a chaperone is present throughout this examination. So a chaperone is usually another member of staff, or sometimes it could be a student if it's allowed within the setting that would witness the entire examination. Generally, breast exam is mostly common in women. There are cases when you could do a breast exam in males, but that's probably beyond the undergraduate syllabus. That's beyond the undergraduate syllabus, actually. So the chaperone should ideally be of the same female sex. Now, with that said, the easy script is wiper, and we've covered wiper. You wash your hands, you introduce yourself, you take permission, you position, you expose, reposition in, you get a chaperone to be present throughout the examination. Mostly in the breast exam, usually you would need to inspect and palpate. Not likely that you'd need to auscultate or percuss. Now, with that said, the script is sitting and sleeping. That's an interesting one, isn't it? So after you've exposed the patient, appropriate exposure for breast exam is from bare, from the top to somewhere around the lower, just the waistline. Yeah, so once you've done that, the very first thing is you want the patient to be sitting, and you want to do what some people describe as Hutchinson's maneuver from Davis Hutchinson, who was a U.S. Breast surgeon, a famous U.S. breast surgeon. And the first thing you want to do while inspecting, you want to ask the patient to do this and pull their hands back and inspect. This may allow you see any abnormality in the breast on inspection. So scars, nipple retraction, deviation, asymmetry in the breast, all of those things. Like I said, our videos, I would not go into the technique of examination because there's a lot of videos already that have covered this. So once you've inspected like this, so hands to the head, hands to the hip, like standing akimbo. And then you now ask the patient to tense. You confirm that the patient has tensed that by feeling for the pectoralis major muscle. And if there's any abnormality on the breast, it becomes much more prominent. Now, once you've done this, you ask the patient to now sleep. You move to sleeping. And the teaching is you examine the normal breast first so you can have an idea what the normal feels like before you move to the abnormal. It's just like the teaching in medicine. You learn normal to understand abnormal. Now, the next thing you want to do is when you want to palpate the breasts, oftentimes most people would ask the patient to lie recline 30 or 45 degrees, depending, like this with the hands that way. You want to palpate the breast in 4 quadrants, and generally you want to start from the outer lower inner lower, upper inner, and upper outer. Then you want to go to the axillary tail of Spence. Now there's two teachings on how you do this. You can do that in a concentric cycle, that way, and end in the axillary tail, or you can do in the quadrant and end in the axillary space. Usually would give you the same thing. Now, if you find a lump in the breast, remember my teaching on should the children ever find lump readily, you need to characterize that lump for all of this. Now, once you've done that, you need to examine the nipple areolar complex. You need to express, in both ways to see whether there's any discharge and what type of discharge. And once you're done with the breast tissue, you must deal with the axilla using the technique, the hand support and shaking technique, which means you shake the patient, with the other hand you support that, and then you palpate the axilla. Now, different books would describe different things, but I think this is a useful technique. And what you're trying to do in the axilla is to examine the 5 lymph node groups. So you have anterior, posterior, apical, central. So anterior, posterior, apical, central, and medial group of lymph nodes. Some other books describe them as level 1, 2, and 3. But generally in the examination, you examine those 5 group of lymph nodes to check for their characteristics, hard, soft, rubbery, as it can give information to the stage of the breast cancer. Once you finish examining the breast, you now examine from outwards of the breast. So once you've examined the axillary lymph nodes, you want to examine lymph nodes in the supraclavicular region, as well as you want to examine the chest, and then the abdomen and the spine, and maybe any other system you think the patient would have pathology in. So in summary, this is how a breast exam would be conducted. So let's do a recap. So in a breast exam, you go wiper, and then you go through palpation, inspection and palpation, remembering that you start the exam with the patient both sitting and then sleeping. And don't forget the Jensen's maneuver when the patient is sitting to accentuate any abnormality. Then when the patient is sleeping, you go through the methods we've described. You inspect, and then you palpate in the right quadrant, and then you go to the axilla, and then you go to the supraclavicular region, and then you go outwards. So this is in summary how you would approach a case of examination of the breast. Do not forget, breast examination always require a chaperone to be present throughout the examination, and generally that the chaperone should be ideally the same sex with the patient. Thank you for listening. Like and subscribe to the channel.